Hello, you're watching Newsline Digital. I'm Pratibha. Thank you for joining me live today. Well, today we're going to discuss about coronavirus, and as always, we're here with another update in a new research that was published in Environment International. It says that coronavirus is only moderately infectious, and key to the spread of COVID-19 is ventilation. Effective ventilation can ensure that COVID-19 does not spread rapidly, and this is extremely significant as we fight coronavirus. The number of cases across the country are increasing, but in what has come as a relief, the R0 value in India has also been decreasing, in some places below 1 as well, up to 1 as well, which is a welcome sign. R0 value, of course, being if one infected person, and looking at how many people the infected person is infecting in coronavirus. So we do know that the cases are coming decreasing by the day in India. Over the last few weeks, we've seen a decline in the number of cases being reported across the country as well. So this research also provides an insight on what it means on the spread of coronavirus. It also speaks about tiny droplets reacting very differently as opposed to a bigger droplets. Anything below 5 millicentimeters also mean that it does not spread much, and the 2 meters distance that we had been speaking of is something that affects largely because of the ventilation in a room. So this is going to have several implications as well. To discuss more on that, Dr. Ramesh, resident doctor at BMCRI, joins us live. Dr. Ramesh, many thanks for joining us. This is a research that provides more details into the spread of COVID-19. Of course, this is a virus that we are learning something new about on a daily basis. But this also speaks about how coronavirus is only moderately infectious. How do you look at this research, and how do you think it affects India's fight against COVID-19?
Yeah, it's a welcoming sign that what the researchers have found out with this study. First of all, we are moderately infectious is a good sign, because we know we have been experiencing a spike up of cases all over India as such. But a good sign would be that the severity of infections being coming down, and also we have been seeing the number of cases being decreasing in Karnataka as well. Coming to ventilation as such, it is an important part since the beginning itself, wherein even the World Health Organization was also confused regarding whether to call it a aerosol spread, whether used to spread through aerosol or only through droplet method. This study somewhat gives us a conclusion that the infection might spread through aerosol, but given that if we provide good ventilation to a room or anywhere where we go with good air circulation, we can minimize the spread of the infection also.
Yes.
Initially, during the lockdown also, when we were seeing the cases, it was like most of them used to be form a close contact individuals, like family members or who used to travel together.
Yeah.
So before the lockdown period, most of the cases we used to be like this. So those clusters used to find that. But once the lockdown was open, due to community spread began to start, so the tracing became usually difficult.
Yeah.
Once this study is published, I think it give a beautiful insight that how we can prevent this the spread of the infection further.
Absolutely. So, Dr. Ramesh, talking about the implications that it is going to have, I'll come to what it means for the common man a little later. But as far as hospitals are concerned as well, because coronavirus, being an infection like this, what is the impact it's going to have in the hospitals as well, especially ICUs as well? Like you mentioned, we need to be extremely careful because usually it used to have air conditioners, and now because of coronavirus, it's going to be different.
Some studies have been published recently by Indian Institute of Science also as well regarding how we need to change our ICU setups as well, because most of the ICUs which were pre-COVID era used to be air conditioned, and due to that the virus filtration used to not occur. So one suggestion what they give is you can use negative air pressure ventilation to prevent cross infection or to spread the infection to our healthcare workers who are in the front line with the patients. Or we can circulate the air in such a way that it can go through filter and then filter out the virus particles as well. or else one more method is used. We can use ventilation as much as possible. Okay, keep the windows open and let the air come in, and spread the aerosol so that it might not get concentrated in one place as such.
Okay. Also, doctor, would you say that this should bring in some policy changes as well? Some rules that had been brought in initially also suggested that in a particular vehicle, any vehicle, there shouldn't be too many people. But those rules have now been relaxed, as opposed to a few other rules that spoke about people not gathering in large numbers. But now it appears with this study that people appearing in large numbers somewhere outside might not be as risky as several people being pulled in one particular car. That would pose more of a risk, isn't it?
Yeah, sure, sure. 500 people accommodating in a closed place would be definitely dangerous. But in case of open airspace, we can, with safe distancing and compulsory mask, we can put forward a policy changes as well.
Absolutely. All right, Dr. Ramesh, many thanks for joining us with your expertise on that. So, this is a research that speaks about the spread of COVID-19, talking about how effective ventilation is key to the spread of COVID-19. And this means that only, and like we mentioned earlier as well, this is a research that said that coronavirus is only very moderately infectious. So, this is a big sigh of relief. Of course, this does not mean that we shouldn't take precautions. We need to continue doing that as well, which means we need to continue wearing face masks as we have been doing all along, maintaining physical distance, whether it's inside or outside, to be on the safer side, and of course maintaining personal hygiene. Well, that's all I have for you today. Thank you so much for joining me live. Please like, share and subscribe to News 9 Digital. Thank you for watching. Take care.